Hello, I'm Dr. Rachel of Evolve Dental. Today I'm going to talk to you about how to remove plaque and tartar from your teeth, how you get rid of that buildup that is linked with causing gum disease and tooth decay. So let's talk about that buildup on your teeth. And first of all, we need to go through the difference between what is plaque and what is tartar and what that means for you and how to clean your teeth to remove them. Firstly, plaque and tartar are not the same thing. Yes, they're both layers of bacteria, food bits, dead bacteria, white blood cells, and all those sorts of funky bugs like yeasts and even parasites. Ugh. But there is a difference between tartar and plaque and what impact they're going to have on your teeth, your gums, and your health. Plaque is a colorless, sticky form of bacteria that builds up on your teeth and gums and needs to be brushed and flossed away every 12 hours. Hence, brushing and flossing twice a day. Plaque bacteria breed in your mouth and use sugar from your diet to survive. The more often you eat sugary things, the quicker these bugs breed and multiply, and the more they poop out their nasty acids into your mouth. Yes, that's what they do. They poop in your mouth, and that's what causes decay. Plaque is constantly forming on your teeth and around your gum line. This is the stuff you can remove with proper brushing and flossing. You want to make sure you're doing it correctly, otherwise you're not going to remove it all. And look, everyone develops plaque because bacteria are constantly growing in our mouth, and these bacteria are clever. They have learned to blend in and they're hard to detect. You can't see them with the naked eye. The early stage of plaque formation is called biofilm, and this is where the bacteria cluster together for survival. Now, the good news is you can brush and floss this off. You can reduce its buildup using mouthwashes and by not eating lots of sugar. However, because of the shape of our teeth, they have pits and grooves and the crevices in the gums that sit around the teeth, you're not going to be able to get rid of all the plaque forming bacteria and every speck of food from your teeth and gums. Some areas are hard to reach and clean, and this is made more difficult if you have crowding, twisted teeth, lots of dental fillings, or teeth that just don't line up nice and straight. Most people do brush twice a day, but the problem is many don't brush for long enough or very effectively, and then hardly anyone is flossing every day. Come on, you know that's true. And then plaque builds up because we aren't disrupting it and cleaning it away enough. Even if you were brilliant at brushing and flossing, you will still get some plaque buildup because of all those folds and grooves in the teeth and the crevice where the gum sits next to your tooth. And that's why we go to the dentist every 6 months for support and maintenance cleaning. Any plaque and food that is not removed from around the gum line daily can cause inflammation and irritation to the gums around the teeth, leading to gingivitis, gum disease. The bleeding, red swollen gums is gum disease, and if that is left to progress, it can become periodontal disease, and that destroys the gums and the bone holding your teeth in. So let's move on to tartar. Tartar, aka calculus, which is Latin for little stones, and it's the scientific and fancy word for tartar, and it's what we call it in the profession. Basically, it is plaque that has hardened and calcified onto your teeth. Don't get this calculus mixed up with the maths type calculus, not the same thing. Calculus is mineralized or hardened plaque. Once plaque sits on the tooth for too long, it mineralizes and hardens into tartar. Tartar provides an even more serious irritant to the gum because it is hardened rock-like material that harbours more disease-causing and more nasty types of bacteria. Imagine having a dirty splinter stuck under your skin for days on end. It's going to fester, it's going to go bad ways, you'll have an infection, and this is what happens in your mouth. Removal of tartar needs to be done by your dentist or dental hygienist. It will not come off at home. You can brush and brush and brush until you are completely exhausted and the bristles have fallen off your brush, but that tartar's not going to budge. You might be able to chip off a little bit with your fingernail, but it's not going to properly be removed, and you will continue to have a threat to your gum health. Now, some people are more prone to their plaque hardening into tartar than others, and they will build up layers very fast, and they may need to come more regularly for dental cleans. This can be an indication of calcium imbalance in the body, and studies are recommending vitamin D3 and vitamin K2 to help get the calcium distribution on track. Now, I'm experimenting with this myself at the moment, and I'm also taking oral probiotics to rebalance the microbiome to see if that helps. So I'll let you know how that goes, and I'm going to cover that more in another video for you. So commonly, most people will get some tartar buildup, especially behind those lower bottom front teeth, the lower incisors and canines. And that shouldn't be too much of an issue as long as you're seeing your dentist every 6 months, and then you get it removed and cleaned away and help keep your gums healthy. And look, if you feel you're cleaning really well at home and yet you're still building up like the Great Wall of China of tartar behind your teeth, then quite simply, you need more frequent cleanings at the dentist, maybe every 3 or 4 months, to be able to keep on top of this. So to summarize, plaque is a bacterial buildup and tartar is a mineral buildup on top of that plaque. Then more plaque sticks to the tartar and mineralizes, and around we go. Tartar is fairly easy to see. If it's above the gum line, you can see the kind of that yellowy buildup, but it can also build below the gum and in the spaces between the tooth and the gum and the teeth and each other. And if you have tartar below the gum line, well, you can't see that. You're definitely going to need a deep cleaning to be able to treat this. And like I said, we don't want that tartar to eat away at the bone that holds your teeth in. We don't want you getting bone loss. So then you need to see the dentist and the hygienist to get that cleaned up. Lots of what we eat and drink remains in our mouth after we've finished, and the bacteria in our mouths then, after we've finished eating, and then the bacteria in our mouths thrive on these many types of foods, and they produce acids as they poop out what they've consumed, and these acids attack the tooth. So if you're not doing proper brushing and flossing every day, you will get more plaque as the bacteria multiply, and you will get more tartar forming, and then you're at risk of cavities and gum disease. And this is why you've got to clean your mouth as well as you can at home and see us for regular professional cleanings. So I'm going to give you a tip that will help you know if you're brushing and flossing well enough or not. And that is to use something called plaque disclosing tablets or liquids. Now, these are food dyes essentially that stain any areas of plaque on your teeth, and then you can, by working your toothbrush and looking in the mirror at the same time, clean away so you know you've got rid of all of it and which parts of your mouth you're tending to miss. Again, I'll do another video on plaque disclosing, and we'll do that in more detail, so make sure you look out for that. So now you know the difference between plaque and tartar and why you need to get your teeth cleaned regularly. Thank you for watching. Please like, subscribe and comment. I'm Dr. Rachel of Evolve Dental.